Have you ever wondered what disruptive behavior disorders are? Perhaps you've heard the term thrown around in conversations or read about it in articles and wondered what it really means. Well, today, we're going to delve into this topic, shedding light on what disruptive behavior disorders are, their symptoms, how they're evaluated, and various treatment options. Let's start from scratch. Disruptive behavior disorders, often shortened to DBDs, are a collection of behavioral problems characterized by ongoing patterns of defiant, rebellious, and hostile behavior towards authority figures. These disorders typically begin in childhood or adolescence and can significantly impact a person's daily life. Now, you might be wondering, what does this look like in real life? Imagine a child who often throws tantrums, argues with adults, deliberately annoys others, or blames others for their mistakes. These behaviors, when persistent and beyond the norm for a child's age, could be signs of a disruptive behavior disorder. There are three main types of DBDs: oppositional defiant disorder, conduct disorder, and attention deficit hyperactivity disorder. Each of these disorders has its own unique set of symptoms and behaviors, but they all share a common thread of disruptive, impulse control, and conduct issues. Now that we've understood what disruptive behavior disorders are and their symptoms, let's move on to how these disorders are evaluated. A comprehensive evaluation typically involves a series of interviews, questionnaires, and observation sessions. Mental health professionals look for patterns of behavior that are consistent with the criteria set out in the Diagnostic and Statistical Manual of Mental Disorders. And finally, what about treatment? It's important to remember that every individual is unique and there is no one-size-fits-all approach when it comes to managing and treating DBDs. Treatment plans are usually tailored to the individual's needs and may include a combination of psychotherapy, behavioral therapy, medication, and family support. In conclusion, disruptive behavior disorders are a group of behavioral disorders characterized by ongoing defiance, rebellion, and hostility towards authority. They are typically diagnosed through a comprehensive evaluation, and treatment involves a personalized approach that may include therapy, medication, and family support. Remember, understanding is the first step towards empathy and effective support. So the next time you encounter someone who might be struggling with a disruptive behavior disorder, you'll be better equipped to understand and help. Thank you for joining us today on this journey of understanding disruptive behavior disorders. Keep asking questions, keep seeking answers, and most importantly, keep showing compassion.